Hello, I am Dr. Girish Nelivigi. I am a urologist from Nelivigi Multi-Speciality Hospital, Bellandur, Bangalore. Today, I want to discuss on a very common urological problem that is encountered in the males. Prostatitis. Prostatitis, as the name itself suggests, is an infection of the prostate. Many men suffer from prostatitis and they are put to a lot of hardship because of that. Prostatitis is of two types, acute and chronic. Acute prostatitis is when the onset is very fast. It is usually because of bacterial infection and it occurs in the elderly and especially those with enlargement of the prostate and those with comorbidities like diabetes. The patient will have high fever, chills, low backache, difficulty in passing urine, painful passage of urine, and also perineal pain. When he comes to the urologist, the evaluation is by urine examination, ultrasound of the abdomen to look for the prostate, and also other blood tests like CBC, serum creatinine, blood sugar, etc. Once a diagnosis of acute prostatitis is made, the treatment is straightforward. The urologist prescribes a course of antibiotics to the patient, and most of the time these antibiotics have to be intravenous and not oral, because oral antibiotics do not work very well in acute prostatitis. After a course of intravenous antibiotics, the patient feels much better. Meanwhile, one has to control his blood sugar, and also if there is enlargement of the prostate, there are some drugs which are available to enable the smooth flow of urine. With these measures, acute prostatitis can be treated. On the other hand, chronic prostatitis is an infection or inflammation of the prostate where the onset is very slow. The usual sufferers are young people or the middle-aged people. Many times the etiology or the cause is not known. They may not have diabetes or they may not have enlarged prostate also. What are the symptoms of chronic prostatitis? The patient may complain of frequent passage of urine, painful urination, a sense of incomplete evacuation of urine, pain in the perianal area, painful defecation, and sometimes low backache. He may not have fever or chills. The course of chronic prostatitis is protracted or prolonged, and the treatment is not as straightforward as described in acute prostatitis. The diagnosis is also sometimes very difficult to make, but an experienced urologist makes a diagnosis based on clinical symptoms and examination findings and sometimes investigations. So the treatment for chronic prostatitis is long-term antibiotics, alpha blockers or drugs which enable the smooth passage of urine, and painkillers. The patient has to be patient in the sense that the treatment is not going to be straightforward and it takes a long time for the symptoms to resolve. However, both acute and chronic prostatitis can be treated and they can be treated successfully. Thank you.